shaken up, was out of the action of that.
As you can see from the video, we're talking about chronic shoulder subluxations today. And it'll be about a 3-hour lecture, but we'll hope to get out of here about 2 hours and 50 minutes early, so great, free time for everybody. Good. So let's get started here, right? So our 3 main learning objectives for today is first, we're going to try to describe the Bankart lesion. So that'll be our first one. The second one for today will be to describe the treatment with the highest level of evidence for chronic shoulder subluxation in an elite athlete with a Bankart lesion, of course. Right, so that'll be number 2. And then the third one, we want to list 2 pieces of high quality evidence of this treatment. Great, so you all got that? Keep that in mind. At the end of the class, you'll be able to tell me those things. Right. All right, and I want you to talk about your knowledge of the Bankart lesion, particularly pathology, the possible treatment options, and pros and cons of the treatment options you discussed. Great, so you all got that? Right, good. Alright, off you go. This excellent group discussion we just had. I like all your ideas. Right now we're just going to quickly talk about what an actual Bankart lesion is. So more specifically, it's the damage to the attachment of the labrum to the anterior glenoid margin. So in your shoulder, you know, well, you know what that looks like. Right, good. It's often due to chronic and repeated shoulder subluxation. So when the shoulder comes out and back in again. Right. Now, it's important that we don't confuse this with the bony Bankart, which of course is a fracture, so bone, to the anterior glenoid rim. And once we've all got that, I think we have a good understanding of where we're going to go. Right, so let's continue. So today we're going to look at a case study about a 25-year-old male. He's a professional basketball player, and he's had a history of the left anterior subluxations over the past 6 months. So the MRI, it revealed a Bankart lesion, unfortunately. So right now, we're going to try to decide as a class what the best treatment option would be for him during the off-season. That's great. So let's just move on. The treatment options that we're going to discuss here today would be physiotherapy as a first option, so P for physio. Then open Bankart repair, we're going to call that O. And then arthroscopic Bankart repair, so we're going to call that A. So these are our three treatment options. Right, so let's just dive in here. In physiotherapy treatment, we're discussing an 8-week shoulder strengthening program. So, you know, dynamic exercises, all sorts of things. 5 TheraBand exercises in particular that were designed to strengthen the rotator cuff and the deltoid. Right, so, you know, deltoid. Good. And the exercises were performed 2 to 3 times daily. Good. So we're going to look at some evidence now about the physiotherapy. So we're looking at this particular moment at a retrospective cohort study, so relatively high level of evidence, average. Right, good. And in the study there were 29 athletes with anterior shoulder instability. So they're having continuous problems with, you know, the shoulder coming out, coming back in, you know. Right, good. In this study, only 16% of the athletes at the end of the study reported back that they had a good or excellent row score. So it's not a really high percentage. Oh, excuse me. Thank you. That's good. Excuse me. Right. So just going back, a row score is an assessment of the functionality, the motion, the stability, so you know, not popping out, of the shoulder in general. We're then going to move on to look at another study that it was an RCT, so a better level of evidence. Right. And they studied a few more athletes, so roughly 148, and these all had chronic shoulder subluxation as well. So 80% of these athletes, after the physiotherapy, still felt reoccurring shoulder instability or shoulder pain, and there was continuous subluxations of the shoulder after the study. So it's really not all that great when you look at it like that, right? Good. So to now, let's just summarize what we've seen in the physio literature. We've noticed that the physio is really a great option if you want a non-invasive treatment option. Really there's no incisions or anything, so it's quite good in that respect. And also, it's a very short recovery time. So if you don't have a lot of time with your athlete, physio may be a good option. But it's important to note here, however, that we're dealing with a Bankart treatment option of physiotherapy will actually treat the problem that we have here with our athlete. So talk about that. Groups. Right, good. So it was a good discussion. It's a good, safe place. I'm really glad to see the progress we've all made here. Right now we're going to move on to the Bankart shoulder repair surgery. And it's involving, you know, repairing the damaged shoulder and reattaching the previously detached part to the glenoid, the anterior glenoid margin. So first we're going to talk about open Bankart. which involves surgery with an incision from the coracoid process to the axilla, and providing good exposure to the injury and underlying tissues. So it's a little bit, more invasive. An arthroscopic Bankart is a procedure, is a microsurgical technique here, right? That involves only a small incision, so a small camera that goes right in there as well. So that's a little bit trickier to see, but we're going to talk about some evidence that we found here. There was a meta-analysis conducted, which consisted of 2 RCTs, so randomized control trials, good level of evidence, and 3 retrospective cohort studies, roughly 3, good, and then once again a retrospective cohort study. And in the end, there was about 156 open Bankart patients, and then 172 arthroscopic Bankart patients as well. Good, we're going to look at the benefits now of the open Bankart repair. And only 10% of the patients that we were studying, or rather the study was studying, had reoccurring shoulder instability. So that's far better than the physio, as you can see easily right here from the beginning. And there was a higher rate of return to previous level of play in comparison to arthroscopic patients. So really, this is right now it's looking pretty good. Yeah, right, good. Limitations, however, and 15% experienced loss of shoulder ROM, so range of motion, and that was more than the arthroscopic patients. Surgical procedure may compromise the integrity of the subscapularis, so it's important to note that, because this is an open surgery, so they're going right in, and that could end up hurting the subscapularis muscle. Right, so that's good. Continuing on, we're going to look at the arthroscopic Bankart repair. It's a little more invasive. Here, there's not that. It's not decreased operative and rehab time, so it's a shorter amount of time afterwards so you can get back to play. So that's also good. Thirdly, here it's important to note, and especially in comparison to the open surgery, right, is that the integrity of the subscapularis and surrounding tissues is maintained. Right, now let's move on to the limitations of the study, as there are some. Here, because of the small incision and what we're doing, there's a higher level of instability post-surgery in comparison to the open one. So it might not be as strong as the open. Right, so now it's your turn. We're going to look back at a case study. Remember what we were discussing? It was a basketball player, left shoulder instability, 25 years old, looking for treatment options in the post-season. Right, so I want you to get in little groups of 3 or 4, divide amongst yourselves. Remember, it's a safe place, good to talk this through. And then I want you to decide what the best treatment option for this athlete would be in this situation. Right, good. Let's end up the discussions here. Right, everyone come back. Good, thank you. There were some good discussions I had. Right now we're going to take it to a vote. Let's go. So everyone in favor of physio as a treatment option. Actually, Michelle, could you write this down? Thank you, sir. Right, so everyone in favor of physio, raise your hands. All right, no one on the fence, raise your hands. Right, so I see 1, 2, right, roughly like 5 people. Right, thank you. Next, we're going to go to arthroscopic. So that's the small one, remember. How many people? We got 1, 2. Okay, good. 36. About half. Good numbers, right? The next one, open surgery. Right, 5. Right, about 42. So, good. A little bit more, roughly the same, however. It's good work, class. So let's from this we know that physio's out. Right. Oh, sorry. Okay. Oh, sorry. Thank you. Right. It's important to note physio's out as a treatment all on its own. It will be used after the arthroscopic and open surgery, but as a means all on its own, it's not a good treatment option for this athlete. So it's basically down to open or arthroscopic, and based on high level of evidence for both arthroscopic or open, they both could be viable options. Right? So really, the final decision is based on the athlete's needs. So right now, what you've hopefully learned are 3 main learning objectives. Number 1, describe the characteristics of Bankart lesion. You should know what that is. Should be able to describe the treatment with the highest level of success and evidence, and list 2 pieces of high-quality evidence, right, for this treatment. That's good. Good work today, class. Excellent.